If your ingrown toenail is red, swollen, painful, or leaking pus and it hasn't settled, this video is for you. Most people accidentally make this worse by treating it like a skin infection. In the next few minutes, I'll show you how to tell if it's infected, what you should stop doing immediately, and when it actually needs proper treatment. I'm Dr. Damien Lafferty, a podiatric surgeon based in Sydney, Australia. I treat infected and failed ingrown toenails every week, particularly in people who've already tried home treatments or had a poor outcome elsewhere. An ingrown toenail becomes infected when the edge of the nail breaks through the skin and allows bacteria to enter. But the key thing to understand is this: the nail edge is acting like a splinter, a foreign body. That's why it's red and painful. As long as that nail edge remains, pain and infection can continue. This is not primarily a skin infection, and antibiotics don't fix the cause if the nail is still there. Signs of infection include increasing pain, spreading swelling, warmth, redness, bleeding, or pus. When you see these signs, home treatment is no longer appropriate. Do not delay care. If you notice spreading redness, throbbing or night pain, recurrent pus, fever, or if you have diabetes or a weakened immune system. Most chronic infections I see start with good intentions and bad advice. You should not dig down the side of the nail, cut a V into it, repeatedly drain pus, or rely on antibiotics alone. If pus keeps coming back, it's because the nail is still acting like a splinter. If the infection is very early and mild, short-term measures can help reduce inflammation, but they are not a cure, and antibiotics may still be necessary. These measures include warm saline soaks, keeping the toe clean and dry, and avoiding pressure or tight shoes. If there is no clear improvement within 48 to 72 hours, this needs proper assessment. Definitive treatment means removing the part of the nail that is causing the problem. This often involves partial nail removal. In cases where the risk of recurrence is high, the nail matrix also needs to be addressed. The goal is to treat the infection without repeated unnecessary courses of antibiotics. One of my biggest concerns is seeing patients who have had multiple courses of antibiotics with no improvement, as this can lead to resistance and stronger infections. This is a patient I treated recently who had ongoing infection for over 9 months, multiple failed attempts elsewhere, and repeated antibiotic courses. Pain control matters. Many people delay treatment because of a previous bad experience, but with proper technique and planning, this is completely avoidable. If an ingrown toenail becomes infected again after treatment, it is usually because the nail matrix was not adequately treated, the nail removal was incomplete, or ongoing mechanical pressure was not addressed. If you have already had a procedure and it failed, that history matters. Ingrown toenail surgery should be pain-free, done once, and definitive. Once the nail edge is removed properly, infection usually settles quickly. Pain relief is often immediate, while final healing takes a couple of weeks, and this should not become a recurring cycle. An infected ingrown toenail is not something to ignore, but it is very treatable when the underlying cause is addressed. If you'd like to learn more about related treatments, I've created additional videos that go into more detail. You'll find them linked below or in the pinned comment. If you found this helpful, please like the video and follow the page, or subscribe to the channel for more practical, evidence-based insights into foot and ankle care.